This nonprofit provides free diapers to parents in need, aims to be a nationwide model. This story was originally published by the 19th and was republished with permission. In America, diapers have long been treated as a luxury good rather than a necessity. Half of families with young kids struggle to afford all the diapers they need. A quarter of families miss work as a result, often because they don't have enough diapers to send with their children to childcare. It's a largely invisible issue with enormous consequences for the health of parents and children. Studies have found that diaper need is a greater contributor to postpartum depression than food insecurity and housing instability. And when parents don't have enough diapers, they make do with sanitary pads, rags, or other materials. Some report having to leave their children in soiled diapers for extended periods, raising the risk for urinary tract infections and diaper rash. So Amy Cadams, who has worked in the diaper space for nearly 15 years, wondered what if diapers were free for the parents who need them most. For decades, the United States has not had a good answer. So she came up with her own. Diaper banks started popping up across the nation in 2011, collecting donations and dispersing diapers to families through a complex network of local partnerships. They are one of the few lifelines for parents. Cadans, who co-founded a non-profit that provides diapers called Share Our Spare in 2011, knew that diaper banks often operate with limited staff and resources and operationally can only address a small percentage of a massive needs. Without more government support, they can only get at a slice of the problem. Federal assistance programs that help low-income families, such as food stamps and the Special Supplemental Nutrition Program for Women, Infants and Children (WIC), have never allowed families to use those funds to purchase diapers. Diaper banks are doing heroic work with very little. I didn't want to reinvent the wheel, Cadden said. But I wanted to continue to sink my teeth into this dot, so Cadden started to work on a solution that could give people the funds to get whatever diapers they needed without the warehouses to store donations or the teams to get those donations out. That solution was Diaper Dollars, a 40 e-card that users get in their email every month. The virtual card comes with a barcode they can scan at checkout at most major retailers, including Walmart, CVS, and Walgreens, that will cover the cost of diapers. So far, users in Illinois and Ohio can access the program. The idea, Cadence said, was to make it as simple as possible, while also giving parents the ability to choose what brands they preferred. Families have brand loyalty, Cadence said. I wanted to keep dignity and choice at the forefront of everything we did. The Diaper Dollars team went through months of market research to refine the tech to work well for participants. They didn't want coupons because there was too much fraud in the system, and gift cards meant users could be limited on where to shop. Instead, they landed on a system that allowed them to build out a catalogue of diapers at 6,200 retail locations in the country. The barcode on the digital card recognizes the diapers when it's scanned and deducts the price from the total purchase. That catalogue of diapers is monitored daily and updated in case brands come out with new box sizes or products. It also works for online purchases. The system does have some limitations. It's not valid in Amazon or Target, two retailers that don't yet accept that form of payment. And it also likely only covers a portion of the need. The average family spends about $100 on diapers a month, but families earning a median income can only afford to cover about 65, according to an analysis by the Urban Institute. It's also more expensive. Parents are paying retail prices, plus sales tax. 23 states charge sales tax on diapers, including Illinois. By contrast, products at diaper banks are donated or sold to the banks from the manufacturer at DP discounted rates. To find participants, Diaper Dollars partners with organizations such as WIC clinics and local hospitals to refer people to the program, which is funded from a mix of philanthropy and financial support from those same partners. Partners establish the eligibility criteria, how long participants can be a part of the program, and whether the stipend will be higher for those with multiple babies. The pilot program launched in 2020 with 100 people. Then in 2024, the Illinois Department of Human Services dedicated $1 million to run its own pilot at a larger scale. Nearly 8,000 people have been served so far, with 10,000 projected by 2026. Illinois LT Juliana Stratton told the 19th that she had been looking for solutions that could support people in the postpartum period when maternal mortality is high, particularly for Black women. Diaper need specifically is linked to maternal mental health and considered a potential risk factor for moderate to high maternal depressive symptoms. According to the Centers for Disease Control and Prevention, in 2020, the maternal mortality rate for Black women was 50.3 deaths per 1,000 live births. For white women, it was 14.5 deaths. So when Illinois launched a birth equity initiative to address the needs of postpartum parents, from a home visiting program to better diaper access, it chose to partner with Diaper Dollars, giving someone a card where they can go to the store of their choice, decide what's best for this, what's part of dignity, Stratton said. Every woman deserves to bring life into this world safely and with dignity. Brendan Kitt, Diaper Dollars program director, said the program was able to offer an operational solution to a problem the state wanted to address that didn't have a mechanism for. The system works similarly to a universal basic income where people in need are